Good evening. Thank you all for joining us tonight. Um, Thank you for joining us tonight. The event is hosted by the Policy Committee of the N.A.H.S.E Houston chapter. We are excited to have you with us as we explore the powerful stories that have shaped policy, specifically. Good evening. Thank you all for joining us tonight. Um, Thank you for joining us tonight. The event is hosted by the Policy Committee of the N.A.H.S.E Houston chapter. We are excited to have you with us as we explore the powerful stories that have shaped policy, specifically examining medical mistrust and the ongoing efforts to right historical wrongs. My name is Sykeria, and I have the honor of serving as co-chair of the Policy Committee alongside my fellow co-chair, Delshawn. We appreciate you taking the time to be here and engaging in this important discussion. We have a dynamic and insightful agenda ahead, so please get comfortable and prepare for an evening of meaningful dialogue. Let's begin. Tonight, we have a meaningful and insightful agenda plan. We will begin by introducing our guest speaker, followed by a screening of Justified Medical Mistrust, Righting the Wrongs. After the film, we'll open the floor for discussion in an open forum, allowing everyone to share their thoughts and insights. Finally, we'll wrap up with question and answer session to address any remaining questions. Tonight's guest speaker is Mr. Bryan Saunders. He is the founder and managing director of TriunityCX, a healthcare experience company focused on enhancing patient and healthcare experiences. He has extensive experience in the healthcare industry, working with organizations such as Guidehouse, Alliant Technologies, and KBI Biopharm to improve customer experience, optimizing operations, and driving strategic growth. At Guidehouse, Bryan led strategy development for the new customer experience division at Indian Health Services and designed frameworks to enhance customer service operations at the FDA. He also developed and implemented performance management initiatives, enhancing operational efficiencies within the FDA's Office of Enterprise Management Services. Bryan is passionate about creating a more human centered approach to healthcare where patients and providers feel heard, understood, and empowered. He is also a dedicated member of his community, coaching at girls' high school basketball and volunteering his time to support various healthcare initiatives. Let's welcome Mr. Sanders to tonight's meeting.
Guess that's my cue. Good evening, everyone. It's a pleasure to just to be a part of this event, and to talk about some very important and engaging topics. I'm excited, and I am so honored that um, it was reached out to actually do this, and so uh, it's just a real good pleasure and a good honor. I do want to apologize for that picture. I was telling them last night that my head looked really big in that thing. I didn't know my head was that big. I should have picked a different picture, but that's all good. It's okay. And appreciate that introduction. It was lovely for sure. So I would love to open this up and get that video started so we can talk about the justified medical mistrust and righting the wrongs. I'll just let them go ahead and.
Community really do have a upward struggle to try and build trust. Patient doctor or patient provider relationship, do they distrust that individual? Not so much. They more distrust the institution that that individual represents.
So the causes of medical mistrust are multifactorial. There are things that have happened historically, centuries ago, decades ago, yesterday, that really can impact how individuals and communities feel about the medical system.
My mother also was a double cancer survivor, eventually passed from lung cancer. She had a very negative experience with a surgeon. And my brothers and I had real challenges with this surgeon.
My grandmother, when she was talking to me about growing up, she remembers a lot of the mistrust that happened when she was younger, and she conveyed that to me. Henrietta Lacks and Tuskegee are more current for her than for me, but she taught me that, to have a healthy level of mistrust.
Dr. Sims, who was a gynecologist, who developed many of the tools that are still being used in surgeries today, but who did those initial surgeries on slaves, on Black women, without anesthesia. Can you imagine the pain that was endured by those individuals, perhaps the screams that the family outside may have heard?
A lot of people think medical mistrust is about history. History is important, but it doesn't discount what people experience today and what is going on currently. Because never in any time, including today, have people of diverse ethnicities and races receive the same care as the majority. And that is happening today.
We do need to talk about the fact that racism still exists, but we also need to make sure that we are thinking about the healthcare system as a way that really can help to be a balm, to really think as providers, what are the ways that we can meet people, to see people, to be humble enough to say, who is this person who's sitting in front of me?
Now, if I see a patient who doesn't engage, who, when I ask if there are any questions, that they are despondent, don't have any questions, don't have eye contact with us, then I know something's off. I know that something's different, and that could very well be mistrust. And so I ask questions. I will ask, tell me what you know about your disease. Tell me what are your prior experiences at this institution with you and your family, and have those experiences been bad, and what can we do to make it better? What do you need to feel comfortable in the clinic? Because when you have that relationship with your doctor and patient, it has to be comfortable. If you don't ask that question, you're not going to know. And then that barrier, that drift will continue between you and your patient, and you may never get there. So the important thing is to be curious, be empathetic, and validate what they have to say.
Eye-to-eye contact, and I was brought up this way, is extremely important when you're talking to, in particular, a physician who is charged with caring for your body, which also leads to your mental, emotional, psyche, etc. So that was extremely important for me. That's where, I don't know if it was a miracle or not, but it was successful for me. Not once could I ever say that I didn't have great physicians.
The Meharry Vanderbilt Alliance is a 20-plus year partnership between Meharry Medical College, which is one of the United States' 4 historically Black institutions that have medical schools attached to them, and Vanderbilt University Medical Center. They struck this partnership to really find ways to not only support the educational mission of each institution, to ensure that the best of both of those institutions were being leveraged, but more importantly, to really help to serve the community with a focus on community engagement and working with a variety of different communities to find out what their needs are. So it's really important for the Meharry Vanderbilt Alliance to be there in the community, building those relationships, spending the time so that we can meet people where they are.
The medical school, instead of building a massive university hospital, really at its foundation decided to go out into the community to spread the medical school at community hospitals throughout the state of Michigan and actually, beyond now, and have students have the opportunity to meet and see people in their communities. And so instead of centralizing medical education and centralizing care, the institution is built to decentralize, be out in the community, that you know your doctor and the doctor knows you, and you have a history and you have a legacy that then just dissolves those barriers down. Just the past 5 to 10 years, where again, the institutions have recognized that there is a need to have diverse populations of clinical trials. And so now everyone is invested in clinical trials. So how do we bring the people to the clinical trials?
After the experience and diagnosis of prostate cancer, then the advocacy edge hit me like a ton of bricks, in a great way, of course. As a race of people, we're locked out of clinical trials by way of the communication, because our people didn't know how to even breach that particular conversation. And now, because of the knowledge window opening up to our people, and what we're saying is that clinical trials and diversity work hand in hand. Now, driving that message is not totally easy. It's very extensive. But we're finding that when we bring the entities, whether they be pharmaceutical reps or doctors, and actually patients who have benefited from clinical trials, people's trust is not waning. It's beginning to take a winning side and a winning edge in this fight against all cancers.
One of the strategies that I used when I was the Associate Director of the Cancer Center in North Carolina was really thinking about populations that may be impacted by barriers. So when I was there, I established a population health navigation program. One of the first things I did was say, go out in the community, spend time. Make sure that you are known. Again, it's that trust building, it's that engagement piece. And we really implemented a program where if a person was coming in to the Cancer Center for the first time, we did a screening 2 weeks in advance. We would give them a call. And we even mentioned that there's going to be a team of individuals talking about the complexity of cancer care. And in fact, they may be offered clinical research as part of their care. For each of those navigated populations, we improved clinical trial enrollment by 50%, 50.
One study that was done a few years ago found that one of the biggest reasons that patients withdrew their consent for a clinical trial is that the doctor didn't want me to be on a clinical trial. Why would they say the doctor didn't want the patient to be on the clinical trial? And it's because that those patients talked to people that they saw higher than the doctor on that trust scale. They talked to a checkout person. They talked to a nurse. When that nurse or that checkout person or the nurse practitioner said, I don't know about any clinical trial, then you have mistrust. And so what you have to do is you have to have everybody in, that everybody understands the need and the desires of the patient, and that it is a team sport. Old institutions put the doctor here and then put the nurse here and everything else. In reality, different communities have that flipped differently, where the nurse practitioner or the nurse or the checkout people, especially if the checkout people or if the nurse share the same background, share the same ethnicity, share the same race, they're going to prioritize and trust those people higher than the doctor.
And so one of the challenges in clinical trials to date has been the lack of inclusive participation. We've not had enough representation of communities of color in clinical trials. And so how do we make sure and how do we know that every treatment is going to work the same in each population? If we think about breast cancer as being one of the most common types of cancer for women, and we know that Black women have a 40% higher risk of dying of breast cancer than any other race or ethnic group. That's a problem. And yet, when we think about the studies that were done in breast cancer to look at the screening and how often you need to screen, fewer than 5% of that population, of those at that clinical trial, fewer than 5% of that clinical trial was comprised of Black women. And so we saw that the screening recommendations were, oh, you don't need to screen until age 50. But yet we missed all of those Black women who unfortunately are being diagnosed with breast cancer at much younger ages and with much more aggressive disease. So having fewer treatment options is impacting the Black community. And yet this treatment recommendation was made despite the fact that the trial itself was not diverse enough to show that we need to actually have screening for Black women sooner. So it's really important for researchers, for institutions that are doing research, to really make sure they become trustworthy. It's really important to make sure you have a relationship so that individuals will know that you are there for them, that communities will understand that whatever institution you represent, whether it be a small cancer center, a clinic that offers clinical trials, that you are there not just to get something from the community, but to give.
All right. Um, that's probably like my 25th time watching that. And every time I watch it over and over again, it gets more and more impactful for me. Just because of the style of the storytelling that's going on there. And so I'm excited to kind of jump into that uh, and how really good storytelling can really make good for great policy change. If we go to the next slide. So the beginning of that video um, was really mentioning just kind of how the systematic racism and all that has just been intertwined within healthcare for minorities from a very, very, very long time ago. Like they mentioned, the experimentation on the enslaved Black people in the 17th century up to the 1800s, dating way, way back to then. And then they also mentioned about how recent it is as well, from the Tuskegee experiments and to Henrietta Lacks and to the forced sterilization of the minority women just in the 1900s, and how those all build on each other into today. And I think it's important to recognize those and to always bring those up into our stories, just because it gives us a solid foundation to know that it's something that's deep, it's something that's old, but it's something that has followed us for generations up until, as Dr. Winkfield said, uh, yesterday. So I think it's very important for storytelling to mention that. And then you even think about how those tie into current medical mistrust things going on. So, for instance, disparities in pain management for Black patients, counting it off as it's just anxiety or it's just stress. Here's some pain meds, and send you on your way, when it could be something as serious as um, fibroids developing, or it could be something as serious as ulcers in your stomach, just things like that that have been woven into us, woven into the system, and it's dating now. Or one that's really important to me because I'm married, a higher maternal mortality rate for Black women. Um, I think about some of the people that I've known that have passed away given childbirth. But that's something that's woven in deeply because a lot of people, a lot of physicians, a lot of the healthcare team will just dismiss some of the pain, just because of implicit bias, which is another thing that's very, very common as well. Um, Another thing that's also very current now is just the limited time for that patient and provider communication. Um, I did an interview with one of my friends who's a nurse practitioner in Washington, D.C., and she focuses on neurosurgery and neurological conditions. Something as complex and as serious as that, she only gets 15 minutes with each patient. 15 minutes to talk about something, somebody drilling in your skull, somebody sawing off a piece of your brain, and only getting 15 minutes to talk about the complications that you have. And sometimes those patients bring up things that aren't really related to it, but she has to brush it away. And that just shows us that this system is broken. This system is not well for the patients, and it's not targeted towards their outcomes. And then finally, something that they also jumped into, which is big for me, is the lack of diversity in healthcare with providers, researchers, and clinical trials. They mentioned as well. Um, I think that even now you see the rollback of DEI, the rollback of funding things that aren't with the current administration's thoughts or their things that they're focused on, rolling back at that, and how that's going to really hurt our community when it comes to uh, continually pushing and continually thriving and continually developing these drugs and these treatments that'll be very beneficial for us. Um, all these things really tie in together to really hurt our trust with just the healthcare system, and rightfully so. Um, I can think of my father who has leukemia, who has diabetes, type 2 diabetes. He has a whole bunch of things, and he's a war vet. But he does not trust the healthcare system. He does not trust anything because of the things that he's seen, the things that he's experienced, and because of the lack of representation amongst not only, as they said, the physicians, but also the front staff, the uh, the nurses, uh, even the cleaning people. Like that whole system lacks diversity, and that really affects everyone's experience within the healthcare realm. Um, and so we can go to the next slide I want to introduce. And so in hearing that video, I think for me, like I said, it really sparked something for me, and it sparks something every time. And it just gets to why it's important and why stories really do matter, and how they're impactful. And so I would love to go through kind of building that out and using an example from the video of showing that. So the key components to storytelling. And side note, I'm gonna throw this in there. On the side, usually on the weekends when both of my boys are asleep, man, and when my wife is asleep, they leave me alone. I'm an independent screenwriter, and so I love writing scripts about different stories, ranging everywhere. And so I think that the reason I picked this tool to really put into my services is to be able to amplify the voices of patients, which is really important, which is getting a lot of steam now in the healthcare realm. Um, so I just want to throw that out there to kind of be able to explain the arc. And so looking at the key components of the storytelling, you got the story, which is one of the most important parts. And not just any just random story. It has to be thought out. It has to be developed. And it has to have a purpose, and it has to have a meaning, and it has to galvanize and cause some kind of action. So on the right, you'll see the narrative arc that I created. Looking at a story at the beginning of it, you want to garner some kind of curiosity. You want to ask some type of question to kind of reel someone in, to really get them so they can pay attention, so they can be grasped, and so that they can be hooked to your story. That's very important in the beginning. And then as the story goes on, you want to start to lay out that layer of understanding of your subject, understanding of the engagement, and you really want your audience engaged. Um, and then the main thing with these kind of storytelling tools that you want to use in healthcare is you want those tools to bring a wave of empathy over the viewers. And empathy and some subsidiary type of feelings are like courage, boldness, or anything like that that'll cause some type of action, whether it's to share the story with someone else, to get involved with whatever the story is talking about. Um, to give your dollars to a politician or whatever it is. You want that action to be drawn out. You want that action to take place with your story. And so looking at Dr. Winkfield's story, I think the at the end of it, that was the one part that really got me when she was telling this story about clinical trials with breast cancer in Black women and how I didn't know that 40% of what was it? Was it 4%? They have a 40% higher risk of dying from breast cancer, Black women. I did not know that. And I have a mom, I have a sister, I have a wife, and I have aunts and cousins and friends and acquaintances and coworkers and clients. All of them were Black women. And I had no idea that it was, that bad. But the way that Dr. Winkfield brought up the information and told the story of that and relayed the data and relayed everything, it really, really got me curious. It got me asking questions. It made me understand kind of where Black women are now with breast cancer, and it got me engaged. It made me empathetic just because just as I listed all the people I know. And my action was to just make sure that my wife is like scheduled with her internal medicine physician to, check those things, to get those kind of screenings just just in case, to be careful. And that brings you to the next part that was really important, was the storyteller. And Dr. Winfield was the perfect person to tell that story. As you're telling a story, you want to pick the right person that's going to engage your audience, that's going to gain that and gain that trust, that's going to galvanize your audience, and its understanding of the story relates to the story, and is able to tell the story in a way that really engages us. And then Dr. Winfield did a really good job with not only her tone, but her body mannerisms, her choice of wording, and how they all combine together to really do the main goals, to really get those main goals, which is garnering that curiosity again, getting that understanding going, engaging us, and giving us a feeling of empathy and driving us to action. And so those two, the story and the storyteller, go hand in hand. If one is off, you're not going to be as effective. Let's say if it was another person, like maybe, I don't know, what if it was SpongeBob telling that story? Like you sitting down there in Bikini Bottom and he's telling the story of that. That's not going to hit as hard as, or important, or it's not really going to have that same effect as somebody who is telling the story of Black woman who is a Black woman and who has had people that have been through that, to tell that story. And so that's why it's always important on those components to have the story right and the storyteller to go hand in hand for that. Um, and then the third and final part is the audience. That story, if she were to tell this to some kindergartners, I'm pretty sure the story would not hit well. Kindergartners were too busy trying to cut paper or draw, or like my kindergartner does, try to play football and beat me up or something like that, instead of hearing what she has to say. Even if it's a team of football players, like the audience has to be aligned with the story and the storyteller as well. And so with this audience, I'm pretty sure it's encompasses a lot of people that are in healthcare in some way, shape, or form. And so that's the perfect audience. And then looking at who's probably going to make this up, which is mostly Black people, Black women, Black men, Black persons. Um, that story is going to hit very well with us because we connect. We all know Black mothers. We all know Black women. We all know Black people that um, may have had breast cancer or are struggling with breast cancer and the like. And so the fact that we were able to sit here and watch the video and hear from her about that, just brings the story all the way around 100-fold. Because I'm sure some of you have been was just impacted with that, and of course you also see the other storytellers. You also have the other doctor who was talking about clinical trials and how most people don't either hear about clinical trials because of the representation of the physicians, or don't trust the clinical trial request or recommendation because how their medical professionals don't look like them. But they'll trust it when the whole team looks like them. They'll trust it. That was very powerful as well. He did a really good job. tying that together in a story as well. And even bringing in a patient. I think that's probably going to be the most important type of storytelling when it comes to that for healthcare, is bringing in those patients where they can talk about their experiences to the right people, people like us who are in the healthcare administration, or who may be physicians, who may be nurse practitioners. Um, Hearing that their representation and them being there matters, it's galvanizing. That's a galvanizing type of wording to hear. One that will, again, force you to take some type of action once you hear that. And so this video really showed a wonderful um, conglomerate of folks, from physicians to patients, talking about the history of medical mistrust, talking about how it's interwoven into our system now, not only in our system, but also interwoven within our own experiences on how, maybe we do trust, maybe we don't trust, depending on what it is. So the video did a really, really good job with that as well. And go to the next slide for me. We can go to the next slide, please. So we heard the stories from them. We know um, that everybody has a story. Everybody has some type of trust. But what can we do with the action that comes from that? What can we do? And I think that we are in a very, very, very important place now, specifically with the new administration that's come in, and it's stripping away funding, stripping away different types of policies, stripping away everything that we've had before that will affect us further down the line, and affect the generations to come. Um, I think what's very important for us in that is, like the physician was talking about, making sure that we have representation everywhere, but expanding that. So we can't stop at just having representation with medical physicians, nurse practitioners, or even clinical scientists that are running the clinical trials. I believe that that has to spread out even further to not only them, but to people like me who offer services like consulting services. So we need people who are doing that are going to really push for things like this. We need people higher up in the healthcare administration and operations for hospitals or other healthcare organizations. We need that representation in senior leadership with pharmaceutical companies, who really need to increase, their diversity. We need those folks who are there. We need those folks that are decision makers to look like us as well, to have our interests at heart, because they'll have the power, decision making power, to really push for different initiatives like this. And we even need to expand even further than that. We also need to have our representation in the different technologies that are being developed, in the different, as engineers, as computer scientists. So for instance, I have a client who she's created a tool that uses AI to give patients power to be able to search for clinical trials on their own. And why that's important is because, as you heard in the video, sometimes we just don't really get those recommendations from our physicians for whatever reason. Maybe it's implicit bias. Maybe they just don't believe that we're interested in clinical trials. But the research shows that clinical trial interest in minorities is there and it's ever increasing. And so not only does that tool give them the power to search for their own clinical trials, it removes the medical jargon, and it makes it so simple to understand, because health literacy is another barrier that minority groups face in terms of that. And it just removes that, and it makes it just clear as day. It could be something for kidney disease, and they said this clinical trial, you'll just take a pill and blah, 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 blah. And so it just really makes it simple. It gives them the power to really reach out to these clinical investigators. It gives them the power to really understand what's going on, so that they're just not in the loop, or they're not afraid, or they don't back off because they don't understand. No, it gives them the power to really search for those things, to really understand those clinical trials, and then also, search for it on their own. And so now we don't have to, we remove the barrier of having to wait to be told about them. and we've been given a tool to be able to go search for our own. Now that's a really cool tool, and there's many more like it out there. There's many more ideas in our communities out there like it. Um, and then finally, we definitely need to continue to expand into the policy makers. And so some of us may have been in college with people that, are been to law school and are thinking about getting into, their local government or state government or federal government. We have to connect with them. They're going to be like-minded like us most of the time, and we have to start building that trust between them. We have to start building those alliances early, and we really have to start focusing on policy early there. And how do we do that? We use things like storytelling to get those points across, to get these patients' voices out, to get their struggles out, to get their conditions out to Capitol Hill, to your states, to your local communities, so that we can just create that web that allows for us to really start breaking through those barriers of medical mistrust and start building those so that the patient outcomes of the minority groups can continue to increase and get better and improve. Um, and I think that's one really good way to do that so we can promote health equity and address that medical mistrust there. Um, so again, just reflecting back on the video, just hearing the different stories of the good and the bad, the ugly, but also the hopeful, the courage, the boldness. We have to get those stories out. We have to use this tool so that we can not only galvanize ourselves as we're in this fight to remove those medical barriers, to remove the implicit bias, to really increase and improve our outcomes within our communities, um, but to really force like policy change. And so, as I said, the administration and now has made it a really tough battle, but with the correct tools, with a sense of togetherness, working with our communities, um, really strategizing, I believe that we can address medical mistrust. We can promote health equity, but most importantly, with all those things added together, we'll be able um, to improve patient outcomes for sure. Um, and with that, I would love to, open up the floor for any questions. I'll try to answer it as best I can. I'm gonna just let you know right now, this ring light I got on got me sweating. It is hot, so I'll do what I can for sure. You can either come off mute or you can put it in the chat if you have any questions, comments, or anything like that.
Good evening. My name is Beverly Ntagu, and thank you so much for this presentation. Thank you for the screening. It was very informative. And I also agree that, storytelling is very, very impactful. And with the way that media and tech is infiltrating different sectors, how can we leverage that and even the younger generation to get these stories out, to get these conversations started, not just in the hospital or with the doctor, but in families and communities?
Yeah, so it's a great question. It's nice to meet you, Beverly. So I'll give this example. With one of my services, I offer a storytelling toolkit that goes through the development process. And one of those important parts of the development process is finding out the best way and the best medium to get those stories out. So like I said, I mentioned I'm a screenwriter, so my main way is going to be developing narrative short stories that will be able to kind of talk about a different thing. So one thing is mine is focused on one of my tools is focused on informed consent and making that so much easier for patients to hear and to understand so they don't have to read those really long documents. So you have to really know who you're targeting and really focus your solution on that. So I would make a short video that actually goes through the process of informed consent, like actually showing them that rather than just having to look at the paper and read it. That's a little more engaging. That's way better than reading a 27, 30-page document. Just having a video of seeing someone go through the process. And then also utilizing the tools that are out there now. AI is taking over, as you know, it's taking over everything. Pretty soon it's going to take over my favorite place, Chick-fil-A, and it's going to take over taking orders and all that good stuff. And so being able to just grasp those tools and learn them as quick as possible, learn them to your best ability, um, and use them to not only streamline the process, but also sharpen the process. So um, you're just using those tools to really get that out there for that. That's what I would say. It's just figuring out who your audience is, where do they um get a lot of their information from. Like my dad, he gets information from my mom, and she gets her information from social media. So another thing would be using social media to get that out. Um, so just really figuring out the medium that you need to use, and then looking at the tools that are at your disposal to do that. I hope that answers your question.
Thank you.
I see one in the chat that says, from Trumisha, I hope I pronounced your name correctly. Um, it says, how do you think we can best support bringing these stories to the mainstream? That's a great question. It's all about how things get out now. It's just sharing, tell a friend, so they'll tell a friend that will tell a friend that will tell a friend that'll tell a friend. Getting it out there as much as possible through any kind of medium that you use, whether it's social media, word of mouth, whether it's through email or anything like that. That's the one main way to do it. Um, and then we got to be strategic with knowing our network. Um, so like for me, I have friends who are in what's the word I'm looking for? Who are in media, who are news anchors, who are in that realm, and they're pretty big up there. And so being able to use that network, I can, share a simple story to them. And if it's something that their constituents really care about, they'll share it. So it's about using that network, but also building that network too. Just because they're not there today don't mean they won't be there tomorrow if just start reaching out and meeting people. So we have to be very, very strategic, intentional, and aggressive in that sense. And then even we're facing what's going on with the administration, as you saw, my man's at Amazon pretty much said that the Washington Post is just going to be throwing out a whole bunch of right-wing stuff. And so we know that Washington Post is a really big one. So we gotta go to those independent people and really support them. Not only give them the story, but support them, amplify their voices, get their voices out there. Even somebody small in our communities who may have an aspiration to become someone like that, to use them as well. We just have to use everyone and anything at our disposal that can really get what we want out. Thanks for that question, Tramisha. I appreciate it. Do we have any other questions? No doubt, no doubt. Well, I'll pose a question to our viewers. I would just love to know, um, what's going through your mind now after watching the video on medical mistrust. Like, how did that affect you? What kind of feelings did it garner? Did it garner any confidence of action, taking some action steps or anything like that? Just would love to know just a response to that video, and it's open to anyone.
I can speak to that. Thank you for asking that question. I worked in research. So when I heard that hearing or seeing people that look like you will help enroll, and so I was thinking, I was like, is that true? I was like, is that really true? Do I trust more if someone looks like me? So it was interesting to hear that perspective. But I will say nowadays you're doing things over the phone. So it's like building that relationship or trying to build a relationship over the phone and building that trust in order to get people to trust what you're saying. So I thought that was interesting.
Yeah, for sure, for sure. I mean, honestly, so I'm in Durham, North Carolina, and it's a really big food spot. I'm gonna trust somebody who looks like me that says that the food is good or bad more than anybody else that does not look like me. Because I'm gonna be real mad if I spend money and that food is regular. So it's definitely true for that. I agree. Anybody else want to answer or any questions?
I don't have a question, but it was just definitely interesting to just hear the video, hear your perspective, and then the question that was asked. So definitely give you a different perspective or just open your mind to a different perspective of things. So thank you.
Yeah, I definitely agree.
I have a question, but I don't know if you're not comfortable sharing, it's okay. I think earlier you mentioned in the work that you currently do, having a hard time or getting pushback on amplifying I'm assuming marginalized voices experience in the navigating the health system. How do you combat that? Because I actually work in the health equity space, and because of the executive orders, we've now been asked to redact information, essentially kind of hide people's identity, and it's been, let's say, pissing me off in the kindest way I can say it, but it's just been really weird on trying to navigate the space now with understanding in the whole course of my career using storytelling to indicate or share how navigating the health system through a marginalized identity have fostered the trust, but also just a negative experience just navigating the health system. And then now with all of the pressure that's coming from the Trump administration, it's like they are aware that these issues happen, but now you're like forced to kind of like now turn a blind eye to these issues. So I don't know if you want to speak to what that pushback may be, and also how have you kind of like pushed back yourself if you have been pushing back, or how have you yourself navigated that?
That is a wonderful question for sure. So I so I kind of tap into my other thing where they mentioned that I'm a girls basketball coach. And I tap into the strategy side of that, and I try to really think about different backdoor ways to if I can't do anything there, I always want to make sure that there's something that I'm doing. So one thing that I really do is I still record as much as I can about the different stories that I'm hearing, whether it's the things that you just talked about, whether it's something that somebody's facing anywhere. I really try to record those stories, and I still try to get them out. If I can't get them out, the usual way that has been working before, because of these executive orders, they can't stop me from just telling my neighbor or anything like that. And so it's just about finding your different avenues to really get that out, so that those stories continue to spread. And I think, kind of like I was talking about how um, Jeff Bezos is pretty much right-winged, the Washington Post, finding those people, finding those people that are like-minded like you, building that community, building that network up, that'll help you continually get those stories out. So maybe it's, somebody that's an independent, what do people do? What are they called? Hey, journalist. There you go. Journalist. Finding somebody like that, or maybe it's finding somebody, knowing somebody who is building some really cool technology that has to do something with media or anything like that. But it's really looking for those resources, looking for the people that are in your network, that are like-minded, that are pissed off just like you, just like me, that are mad, and just got to be bold, courageous, and really take those steps to just continually get those voices out. Because what they're really trying to do is just quiet it down. They're trying to build some alternative reality. They don't want to hear from us or anything like that, but we can't let that happen for sure. Um, and that's kind of what I'm doing. I'm using those different avenues, um, and then I'm just really pressing forward. Just kind of like how they're ignoring the different orders from like the federal judges and appeals and stuff.
Absolutely.
Mine too. Ignore mine too.
Mhm. Yeah, thank you for that. I think that that's just been where I've been kind of like toying with, is being more creative on doing that, which is why I came into this space, since I've seen this um, is a way to kind of have this conversation to hear what other people have been doing and experiencing as well. So thank you.
Yeah, no problem, no problem. That was a wonderful question. Okay. If no other questions, I'll definitely pass it off to our host. Again, I really appreciate you all having me and listening to me and uh, just enjoying this time. And it was definitely a pleasure, and I would love to do it again for sure. And with that, passing it off.
Thank you, Mr. Saunders, for the information that you provided to us. We also just wanted to say, hey, the policy committee always welcome individuals who's willing to want to support and add to the committee. So definitely, if you're interested in the policy committee, please email us at nahsehouston@gmail.com. Thank you, and we appreciate your participation. Have a great rest of your evening.